Hey, welcome back. For this video, we are going to learn the basics of what does it mean to be a travel healthcare worker, aka what is a travel nurse or a travel physical therapist or sonographer. What is it exactly? How did it get started? And most importantly, what is your role as a travel healthcare worker today? So first, let's do a very brief history of where it started, because this industry itself is not even that old. It was in 1978 that the very first travel nurses became a thing. It was during Mardi Gras in New Orleans, and there was just 7 travel nurses that traveled. I think they might have been up in Boston somewhere. They traveled down, they all stayed together, dorm style, and I think the records say they worked for $11 an hour during that season. And then year after year, it grew bigger and bigger and bigger, and a big reason is because of the shortage of nurses. And because of that, there were different places around the country that just could not fill enough spots. And so they would pay a little bit more money for someone to travel across the country, and they would also put them up in housing and then have them work there for a season. And as this got more and more popular, the industry itself shifted a lot. At the very beginning, it was more for younger nurses. It was kind of like if you were to backpack to another country and you just wanted to experience something fun, and the pay was just a little bit more. But most people didn't do it for pay. There was no such thing as tax-free stipends. It was actually just a really fun experience. But at some point, the industry grew so big that a lot of people actually made travel healthcare their career choice. It wasn't even that long ago. It was definitely after 2000 that most of the companies started implementing the thing that we know today as being able to get tax-free money as part of our paycheck. And so the part of the travel healthcare industry that became a lot about, oh my gosh, you can make such great money, and wow, this is so exciting, there's just jobs everywhere, is relatively new. We're a bit of a young industry in general. And the industry is getting shaped by us as travel healthcare workers and what we need. It's getting shaped by the hospitals and what they can afford and what they need. And it gets shaped by the agencies in the middle, the staffing agencies, and how they do their business to connect the two together. So today, I think what is most important to know is where we fit in the healthcare system. So one thing to keep in mind is facilities hire travel healthcare workers because they can't find permanent or even PRN staff to fill the spots. Travelers are gonna be among the most expensive way to bring someone in to see patients. So it's usually not a first line of defense. What that means is hospitals and facilities are also typically gonna have higher expectations for travelers. If you just put yourself in their shoes, they do have a budget that they're supposed to hit. And when we come in and we're more expensive as travelers, there's a few things they want. One, that we're gonna hit the ground running. They're not looking for someone who needs a lot of mentorship. We're typically there for just 3 months at a time. But they're like, hey, you've gotta already know how to treat the patients we have here. I need you to be experienced. I need you to be efficient. I need you to be fast at documentation, fit in well with the team, and just come help us. If you're someone that doesn't have a lot of experience in that setting, they will likely choose someone over you that does have experience, because really you're coming in because they have a census that needs a traveler. They don't just hire travelers for fun. So it's not unusual for us to go to an assignment and on day 1 we have a very quick orientation and we're seeing patients independently on day 1, which is not as common when we get a permanent job somewhere and they give us more of a longer orientation. The second thing that kind of goes along with that is with paying us so much more per hour, they do expect us to be more flexible. If, for example, they need us to float to a different department so they can fulfill the hours that they said that they would give us, there is an expectation of travelers to be the yes person, to say, yeah, I'll float there. I'm here to help you guys. I'm the traveler that you picked. I'm glad you picked me. I'm gonna float to different units as long as it's in my skill set, as long as the patients are safe. If they're asking to float you somewhere that you're not safe or you haven't done that before, that's totally different. But there is kind of an understanding that travelers are meant to be there to really help the facility. And I think the other thing to just mention on that note is we get to come in for 3 months at a time. And it's really good for us to just go along with the culture that they have in place. And sometimes this can actually be hard because you might go to a hospital and you've been a traveler for a while, let's say, so you've seen many different hospitals around the country, and you know a better way for this hospital to do whatever it is they're doing. But the hard part is, even if you know with 100% certainty, yeah, I have the answer, I know what this hospital is doing wrong, we have to remember we are not hired to be consultants. They really want us to come in and see patients and fit in with their culture. And so a lot of times as travelers, we are meant to bite our tongues a little bit and say, how can I best help you? How do you guys do things here? I'm literally here to work the hours that you guys hired me for and to help out and to be friendly. And that is pretty much what our job is. I will admit I learned this the hard way myself. I thought, wow, I could come in and really teach some of these people different ways they could do things. Wow, they're gonna love me, I know so much. No, it never went over well, and I learned very quickly I am not a consultant. I am not a mentor to them when I'm a traveler. I am there to serve them, and it works so much better to just go in with that mindset. You just get to see some patients and make some friends, hopefully, and explore a new area, and that will make you a really great traveler. If you want to keep learning all about travel healthcare, like and subscribe to this channel. We have new videos that come out every single week, all about this topic. And of course, go to Nomadicare.com. That is an amazing website that is just for healthcare travelers, full of resources and tools that are free for you to use.